This is a short set of slides introducing you to nephrotic syndrome and nephritic syndrome. So there are two different types of processes that can occur within the kidney that represent injury to the glomerulus. Nephritis, I remember the itis, I, inflammation, and nephrotic syndrome, I remember nephrotic O is the presence of protein, O, protein in the urine. So normally there's little or no protein in the urine, but in nephrotic syndrome, the protein is lost in the urine because of an abnormality in the filtration process. Most of that protein is albumin because that's the most common protein in the serum. And here's the kidney saying, sorry, I keep spilling all this protein. I hope that doesn't cause any problems. In fact, it does cause all sorts of problems, and we're going to go over some of those. But you can see in this urine sample, there's sort of a frothiness about the top of the sample, and that's typical with proteinuria. Here's a mnemonic for you to remember nephrotic syndrome and its features. So you get sodium Na decrease, hyponatremia, albumin decrease, that's the loss of albumin, proteinuria, which is largely represented by bright albumin, hyperlipidemia, that's an increase in fats in the serum, and the reason that is because the liver is working hard to compensate for the protein loss with the proteinuria. It's trying to make as much protein as it can, and in doing so, it also makes lots of proteins that are related to carriers for lipids. Renal vein thrombosis can occur. That's a risk factor when you have nephrotic syndrome. Edema, orbital edema, is representation of the systemic edema that can be a result of proteinuria. Thromboembolism, again, the risk of forming clots. Infection is due to the loss of immunoglobulins in the urine. So immunoglobulins are lost just like the protein is lost. And when you lose your immunoglobulins, you don't have them to fight infection. And then coagulability due to the loss of antithrombin 3 in the urine. So with nephrotic syndrome, you have hypoalbuminemia, edema, and hyperlipidemia. This slide compares the two syndromes, nephritic syndrome and nephrotic syndrome. So nephritic syndrome is inflammation of the glomerulus. It can lead to hypertension, hematuria, and oliguria. Berger's disease is an IgA nephropathy and is the most common cause of primary glomerulonephritis. So that's where you get IgA deposited in the basement membrane, like we discussed with post-strep, but it's a different disease in this case. Nephrotic syndrome, on the other hand, is the O. That's associated with hypoalbuminemia. You can think of the O as little holes in the filtration system that allow the escape of protein. So you get massive proteinuria, you get peripheral edema, and you get this dog thinking that he's going to become muscular by sopping up all this proteinuria. You get hyperlipidemia as the liver tries to compensate by producing more proteins.